Hello, everyone. I am Leslie Munoz Velasquez, and this is my partner, Anna Reese. And we're going to be presenting on the human experience of Duchenne muscular dystrophy, or DMD. This is going to be an informational video for patients and families and patients with DMD. And we'll start off by looking at how care for DMD patients would transition from birth to childhood to adolescence and ultimately to adulthood. So as many people may be aware, there's lots of interesting research being done on DMD and on potential treatments and cures for the disease. The current corticosteroid treatments that are recommended have had a positive effect on muscle function and in some cases have shown to slow down the progression of muscle degeneration. There's also very interesting research being done on gene therapies for DMD, such as exon skipping or virus-mediated protein reintroduction, which are also promising therapies. As a result of the increase in quality of care, the life expectancy for many DMD patients has also increased in the past several years. This means that there is an increased need for transitional healthcare plans for patients with DMD. As patients transition from childhood to adolescence and later to adulthood, it's normal for them to develop a desire for a greater degree of independence. However, the progression of the disease provides challenges to this, as there is a greater reliance on caretakers for everyday activities because of the nature of the disease. Since DMD is a progressive muscular degeneration, patients lose mobility and there is an increase in muscle weakness. Thus, it is important for the patient to be involved in the planning for transitional care as well, so that their needs, wants, and individual values can be reflected and accommodated during the transition. The involvement of the entire team of providers is also essential to a successful transition in care. So from the time of diagnosis, there's usually a team of medical professionals already working together to facilitate care for a patient and to treat every aspect of the body that's affected by DMD. Typically, this would consist of a team of specialists in fields ranging from physical therapy to cardiology to nutrition, among many other specialties. And this multidisciplinary care should continue into adulthood in order to provide the patient with the best quality of life. During the earlier years of development, these specialists will most likely also subspecialize in the management of these body systems in pediatric patients. As the patient develops, the disease progresses, and care needs to be adjusted to account for this maturation. Finally, once the patient reaches adulthood, it becomes more appropriate to transition to providers that are more skilled at handling DMD in adult patients. So during this transition, the providers can serve as great resources for patients and their families when looking for other specialists, facilities, or organizations and institutions that can help provide the necessary care. So they should also be able to facilitate the transfer of medical records and other important documents to the adult care providers. Furthermore, providers can shift from a family-centered care to a patient-centered care as the patient becomes more autonomous in terms of decision-making. It's also likely that patients with DMD also work with a team of educators in order to accommodate any special needs for the child. So as the patient matures and becomes more independent, it's also important to consider how educational targets and outcomes could change. The transition to higher level education could bring with it several new challenges. For example, factors such as online versus in-person classes and the resources available to students with disabilities start to play a more significant role in the patient's education. Additionally, it's important to look at the future in terms of future vocations and possible employment for the patient in order to further facilitate independence. So when should patients and their families start planning for a transition in care? A normally accepted age for adulthood is 18 years of age, although a transition and planning should begin well before this milestone. Some researchers and clinicians have suggested that families should be informed of the need to transition when the patient is about 12 years old, and the planning process should take place when the patient is between the ages of 13 and 14. In addition to discussing and creating a plan, it's also encouraged that the plan is reviewed and revised if necessary on an annual basis in order to stay up to date with the patient's needs and also any changes or developments in the disease. And next, we'll take a closer look at some of the aspects of care and treatment mentioned above that DMD patients experience.
One of the important factors that DMD patients and families should consider is exercise. And when considering exercise, flexibility should be the primary focus of any exercise program they partake in. Stretching is the main exercise that DMD patients should practice, and it should consist of passive and active stretches. You should also be careful to not cause any muscle damage. So therefore, it's not recommended to partake in ballistic stretching, in which you bounce up and down in your stretches, or in any eccentric movements, as this has shown to further damage muscles in both animals and humans. Your stretches should be performed 3 to 4 times daily, held for 10 to 30 seconds, and repeated 3 times to 4 times a day. Stretches should focus on muscle groups prone to contractures, such as the hip, knee, shoulder, wrist, fingers, and plantar flexors. Next, education. Students with DMD are recommended to have an individualized education plan or a 504 education plan. An IEP typically involves the following: the involvement and progression of the child with a disability in a general curriculum, all related services for which the child qualifies, appropriate educational accommodations necessary for the child to be successful, the child's present levels of educational performance, and measurable annual goals and objectives for the child's education. Education following high school takes detailed attention, as Leslie mentioned previously. School personnel, vocation counseling services, and formal transition clinics may be able to offer you additional guidance, but not everyone seeks additional education beyond high school. Your particular strengths and talents should be cataloged to create a program of daily activities that are meaningful and rewarding for you. Nutrition plays a big role in managing DMD, so it's important to start a DMD-friendly diet as early as possible. We are going to discuss some goals of dietary therapy and how to achieve them. The first goal is to preserve lean muscle and minimize muscle wasting. You want to aim for at least 1 gram of protein per kilogram. So to determine the minimum grams of protein needed, you should divide your weight in pounds by 2. Good sources of protein include fish, eggs, seafood, and meat. Another goal is to keep your bones strong. You will want to focus on your calcium intake for this goal. Depending on your age and if you're on steroids, your calcium intake will vary. For example, if you are between the ages of 4 to 8 and are not on steroids, you should be eating around 800 milligrams a day. But if you're the same age and taking steroids, you should increase this to 1,200 milligrams a day. Good sources of calcium include dairy, leafy greens, and beans. The next goal is to preserve excess fat buildup and weight gain, which can sometimes happen when you are on steroids. To prevent this, you will want to follow a low glycemic index leaning plan. This plan is to help maintain a stable blood sugar and insulin level. You will want to eat low sodium and practice portion control. Another goal of dietary therapy is to maintain normal cholesterol and fat levels. Make sure to pick healthy fat sources such as nut butters, unsalted nuts, seeds, canola oil or olive oil, fish, and avocado. You will want to avoid butter, full-fat dairy products, fried food, fatty meat, and packaged foods. You will also want to prevent constipation, which is a common experience for DMD patients. To prevent this, make sure to eat plenty of fiber. Good sources of fiber include whole grains, legumes, seeds, nuts, fruits, and vegetables. Lastly, always maintain a healthy fluid intake. Aim for about 1 ounce per pound of body weight with a maximum of 100 ounces per day. It is extremely helpful when the whole family embraces this DMD-friendly diet, as everyone benefits from the principles of this healthy way of eating.
Ultimately, the treatments that Anna mentioned are ones that tend to stay relatively similar throughout a patient's life, with the stated exception of education. Again, it is important to maintain continuity of the multidisciplinary care that is introduced in childhood all the way through adulthood. For more information and resources on what current treatments for Duchenne muscular dystrophy look like, and to discuss a transition plan to guide you and your family through transition in care, you can talk to your provider and ask them what steps you can take to ensure the best possible care.
Thank you all for listening, and here are our resources.